The US healthcare market is about a $4 trillion market. And anybody that has spent time in that market, I think clearly recognizes that this is an incredibly inefficient market. And that inefficiency actually creates opportunity. Now, when we think about it, what we're looking for are opportunities to invest behind companies and invest in markets where we can drive quality up and cost down. And our view is that if you're delivering high quality care at a low cost, regardless of what the broader economic market looks like, that's going to be an attractive opportunity.
Value-based care is the way that we've thought about investing behind providers. There's an intense need for this within healthcare. There are legacy providers that are inefficient or have reimbursement models that are focused on providing more care rather than better care. And so we're intensely focused around patient outcomes, lowering costs, better patient experience, and aligning around value-based reimbursement, and wherever we can on focusing on some of the bigger problems in healthcare, which is more complex patient areas that have been underserved historically. And if we can go into those areas, provide better care at lower cost, we're providing a great service first and foremost to those patients and their families, but also more broadly to the US healthcare system by taking cost out of the system while leading to better outcomes.
This is an incredibly durable theme because there's so much waste in healthcare. That waste can come in many, many different forms. It can come in the form of unnecessary care. It can come in the form of inappropriate pricing. And part of what we're intending to do is wring out those forms of waste and actually align the incentives and align the interests of the patients, ultimately with the payers and the providers.
So over the last 10 years, there has been a large shift in healthcare in the United States, and that shift is toward value-based care, which is providing the highest quality care at the lowest possible cost. One of the key themes for us has been the site of care shift toward lower acuity settings. So this is care moving from what historically was done within a hospital to an outpatient setting, and in some cases to a patient's home. That's a huge shift in US healthcare, and it's an ongoing shift that probably has another 15 or 20 years to go before it's complete.
We've invested behind that through SCA, our ambulatory surgery platform, where if you needed a hip replacement or cataract surgery, it can be done at a fraction of the cost and more convenient for you. We've extended that further by investing in home health via Kindred at Home, where there are many things that can be done even in the patient's own home. More recently, we backed a platform called OneOncology, which is the largest management services organization for community oncologists, those practicing outside of the hospital. And though it's the same infusion, the same procedure, it's a fraction of the cost of what's still being done in the hospital, and thus better for the system and better for the patient.
We're focused on examples that align around reimbursement. So we have a number of investments in value-centric care that are totally aligned around making sure that the reimbursement to the provider is oriented around getting the right outcomes for the patients and the right patient experiences. Those would be examples of businesses such as Kelsey-Seybold or OneOncology, where we as an investor in the provider are saying, we only want to be paid if we're doing a good job for the patient and a good job for the healthcare system by lowering costs.
During COVID, supply chains in all industries became more in focus. Healthcare certainly was part of that, and it shone a light on how complex it is and the challenges that are created when it's not running efficiently. And so we've looked for investments that add analytics and capabilities to the healthcare supply chain as a better way to track its performance. Understanding exactly what is supposed to take place and what's happening within the supply chain is certainly an important piece, but then there's also the execution of the supply chain. And so we've looked for businesses that can actually bring expertise and operations to the supply chain in an outsourced way.
I think, speaking broadly, our goal is to just build great companies. And what that means for me is we want to focus on both performance and health. What I mean by performance is the top line growth, the bottom line growth. It's many of the quantitative metrics that people think about. But just as importantly, we think about health. And what that means for me is a source of renewal. So how do we know that the company is going to grow sustainably for a long period of time? What that requires is investment in things like capabilities at the company, the people, the R&D, all of the resources that are necessary ultimately to drive long-term sustainable growth.
We've been at this for almost 2 decades, focused on value-centric care. So it's an area that we know well. Over that time, we've built up deep relationships with all players in these ecosystems, and it's enabled us to really work closely with companies and help them achieve their full potential.
The ability to drive transformational change where you think it's a great neighborhood, but there's a company that needs some fixing or repositioning or augmenting. That's not something that everyone can do, and to be able to harness those resources that we have to not just back a trend, but in some ways help create it, I think is really differentiating.
One way that we try to express those themes is in the form of corporate partnerships. So one thing that we've done a huge amount of is to work to understand the needs of different constituents across the value chain in healthcare. And a big part of what we're trying to do is understand what are the problems that they face and how can we partner with them to collectively solve their problems, but also address the broader problems in healthcare.
Given the amount of complexity that exists in the healthcare system, given the changing reimbursement dynamics, governmental dynamics, the strategics in this space are increasingly going to need help. And I think that plays really well into our core focus on corporate partnerships and carve-outs. I think we can really help drive change where it might otherwise be difficult.
GoHealth is a good example of this, where we invested in a very small business and brought in a great CEO that we believed could help transform this business and create a much more innovative company than what we invested in. We did this in a joint venture partner model where we are partnering with large market-leading not-for-profit health systems in 50-50 joint ventures to build urgent care clinics, to do virtual care, to provide care to schools and directly to employers within these markets. Fast forward to today, we've built over 200 de novo urgent care centers and provide care to over 3 million patients annually.
Over time, what I would expect is a greater and greater alignment between the payers, the patients, and the physicians. Ultimately, there are only three constituents who can make judgments about what care is delivered and at what moment in time. That's the payer, that's the patient, and the physician. When you align the interest between the payers and the physicians, ultimately what you get is higher quality care at a lower cost.
I think that the need for providers who are focused on value-centric care is only growing. When you look at the US healthcare system, it's growing at a rate that's not sustainable, and the biggest area of spend is typically around providers. And the only way we're going to address that is to change the model and have more investment behind businesses that are focused on better patient care, better patient experience at lower cost. And we found that that's continued to generate very attractive investments for us that are creating companies that we're very proud to be associated with and that are doing real services in the US healthcare system.